Welcome to the WowMD podcast, where in each episode, you will get in 30 minutes or less valuable pearls about holistic wellness, anti-aging, hormone therapies, beauty trends, and other facts you should know about our medical healthcare system and your health that no one is telling you. My name is Dr. Mirala Chernayanu. I am a conventional board-certified OBGYN physician who, after the loss of my father due to a careless and uncaring medical team, decided to retrain and seek certification in anti-aging and restorative therapies. What I know, I am happy to share with you. Hello there and welcome back to the WowMD or Wellness Optimizing Warrior MD podcast. Today's episode is all about WarmSculpting platforms. So as I kind of started with liposuction is not good. It's not my favorite. And then I went into body sculpting and I did a big review of CoolSculpting versus WarmSculpting. And I clearly told you I don't like CoolSculpting for various reasons. If you're not sure what those reasons are, please revisit my previous podcast episode. But this episode, I'm focusing totally and completely on WarmSculpting platforms. And I'm adding other platforms that are also all about body sculpting, but in a different way than destroying fat with heat. So let me talk about these WarmSculpting platforms. First and foremost, I'm going to talk about TempSure. This is the one that I'm most familiar and comfortable with. I've used it since 2015, maybe 2016, sorry. It uses laser-generated heat that destroys the fat cells after heating them to about 42 Celsius degrees, maybe 47 in some cases, depends on how intense the treatment is. The treatment sessions are 25 minutes, about half the time of the CoolSculpting sessions, and the device has about 4 applicators, each covering about 24 centimeters square. There's a total of 96 centimeters square by all 4 frames lined up together. So it's about 15 inches square. The frames could be a single frame, a double frame, a triple frame, or a quadruple combination frame. For example, for a love handle treatment, you might need either 2 doubles, 1 double on each side, or 2 triple frames. Occasionally, people have needed all the 4 frames all around in order to sculpt the waist. So you can also use 2 in the front, 2 in the back, all 4 on one side. It's highly customizable, okay? 25 minutes. It has the sapphire cooling plaques that keep the skin cool. Heat, like I said, it's feathering. It has a feathering effect. You will not have any shark bites. The chance of a burn, I think in my 10 years of using this laser, I had one tiny little blister for one patient. Either we were not paying attention or we didn't have good contact. Long story short, she didn't feel that it was too hot, but she developed a little blister a few days later. It turned into a little tiny burn. She got a cream, Silvadene cream to use. It healed without a scar or any kind of problems. Okay? Let me move on to another platform. Let's talk about radiofrequency technology. So let's talk some RF. Well, you might have heard of Thermiva, still around, has been bought in 2019 by another company. But let me talk about a similar technology, also RF, but better and superior due to the advances in their temperature reading sensor. That's called TempSure. It's a platform from Cynosure. Both Thermi and TempSure use RF. For this technology, you need an applicator that delivers radiofrequency upon contact with the tissues. The applicator has to be constantly moved, so the treatment feels like a hot stone massage, but the difference is that the TempSure device has a sensor in the tip of the probe. So the radiofrequency platform for TempSure records as time of treatment only the time that the tissue, specifically the skin, is heated to 39 Celsius minimum. You cannot heat the skin to more than 42 Celsius. It is too uncomfortable for people. And with radiofrequency, you have to constantly move the probe that delivers the energy. And you keep delivering the energy by coming back quickly to the same area to make sure the temperature does not drop below the required temperature range. Now, the radiofrequency delivery is superficial. Yes, you can melt fat with it, but is mainly to tighten the skin and to improve the cellulite. You need way more treatments to melt the fat than it takes with one SculpSure treatment, okay? Unfortunately, though there is a minimal skin tightening effect with SculpSure, radiofrequency technology is much better at skin tightening. And due to the combination of the heat and the massage, you can actually break down the cellulite bands and you can improve the appearance of the area that we're treating. Whereas the SculpSure does not really impact or improve any cellulite. It just does one thing, it does it well, and that thing is melt fat. What about delivering radiofrequency without contact? What about Vanquish? You might have heard of it, you might have read about it. This is a body contouring procedure that targets fat cells with heat at a specific temperature and length of time. During this treatment, you lie beneath this device while there are sensors assessing your body fat to determine the correct energy level. The device will emit this focused field radiofrequency, our energy, which heats the skin to about 101 Fahrenheit degrees, and it heats the underlying fat to about 120 Fahrenheit. There's no portion of the device that will touch your body. Treatments are usually 30 to 45 minutes long. It has been FDA approved for fat reduction in 2015, offers its own benefits over other WarmSculpting devices, but there are some drawbacks to consider. It's a radiofrequency device. Remember, you need more treatments to achieve the desired results. Most people require about 6 treatments or more once a week. It can treat larger areas, the same as TempSure, right? It treats areas that are a larger half circle. It could include the entire abdomen, including the sides and the front. It might make Vanquish a good choice to reduce the waist circumference depending on the size of your waist circumference. Cost is rather high. You need multiple treatments. And again, it will not penetrate as deep as Photona or SculpSure. This brings me to my number 4 platform to talk about today, the device called Photona. Photona tight sculpting is a very unique dual wavelength, non-invasive laser treatment for sculpting and skin tightening at the same time that can pretty much be applied to all body areas. This exclusive delivery method is used as a combination to both destroy the fat cells underneath the skin with heat, as well as for collagen remodeling of the skin that's lying on top of the treated area with exceptional results. The procedure is reasonably fast, about half an hour to an hour, very safe, absolutely zero downtime. As opposed to all the other lasers, SculpSure has also zero downtime. Okay, all the RF has zero downtime. And that's the cool thing about these procedures, okay? It's completely non-invasive alternative to any laser lipolysis. The first step of the procedure, the fat melting, uses a unique super long ND-YAG pulse mode. It's called the piano mode. It is designed for homogeneous tissue heating, and it does the heating of the tissue comfortably, safely, and rapidly by concentrating the energy delivery to subcutaneous tissues to alter the metabolism of fat cells. So it's leaving the skin on top absolutely intact. The piano mode extends this pulse duration of the laser wavelength into the seconds, resulting in full thickness bulk heating and a synergistic tightening effect, because the second step of the laser treatment with Photona is an improved skin surface laxity treatment with smooth pulse. This is a revolutionary non-ablative erbium YAG mode, ideal for skin tightening. The intense controlled surface tissue heating stimulates collagen remodeling and will initiate new collagen production. The overall result is an improvement of laxity and elasticity in all the treated areas. Last but not least, tight sculpting procedure allows for large body area treatments because it uses an adjustable scanner with a very high versatility for area shapes and sizes. Photona has an innovative matrix view temperature monitor, which ensures an effective and controlled treatment with patient comfort and safety. It is connected to a Zimmer, which will keep the skin cool. Like all WarmSculpting devices that deliver heat that has to go through the skin, you need to prevent the heat from coming right back up through the skin and diffuse into the environment, which will heat the skin to the point of burn. So you want to cool the skin and at the same time keep the heat into the fat tissue. So the heat has no place to go because it cannot dissipate to the surface due to the cooling of the created by the Zimmer. So it will continue to be maintained into the fat tissue, killing the fat cells. Before I move on to my number 5 platform, let me say a few words about why I personally decided to acquire WarmSculpting versus CoolSculpting. Now, pretty much my entire last episode was highlighting why I believe WarmSculpting is superior to CoolSculpting. But to sum it up, I decided to acquire TempSure in 2016, and I have used it successfully for many clients. I really have seen nothing but great results for all the clients that follow the treatment protocol and accept that the number of sessions required to treat the area that bothers them might be 3, 4, or 5. I also wanted to acquire TempSure instead of Thermiva or ThermiRF. I had a long-standing relationship with Cynosure at that point. They convinced me that their device was superior to Thermi. And interestingly enough, Cynosure came up with an applicator to the TempSure platform, FlexSure, a flexible radiofrequency pad, which is attached to the skin to deliver the heat through the patch. And it works really great to tighten the skin and improve the appearance of the skin in all areas where delivering heat might be uncomfortable, like the arms, the inner thighs, above the knees, etc. I do have the Photona, which I acquired in 2020, but I literally bought this laser for vaginal rejuvenation purposes and to work on urinary incontinence. And as it turns out, this laser is literally a workhorse of a laser. They can do so much more. And I do love its capability for tight sculpting. So my 5th platform, Morpheus. What about radiofrequency microneedling? Well, Morpheus 8 is a combination of microneedling and radiofrequency energy. It's designed to mainly remodel your skin by creating controlled microinjuries that prompt the body to produce new collagen and elastin, while the radiofrequency energy will help tighten the deeper layers of the skin. This very powerful technology can treat various issues like fine lines and wrinkles and acne and scars and mild skin laxity. So, interestingly enough, the Morpheus 8 body, as well as the face, has needles coated with a protective layer. These needles go into the tissue beneath the skin. The needles help make the fat firm up and tighten the connective tissue, which can help the appearance of the tissue. At the same time, we have this controlled radiofrequency energy delivered to the targeted area. And for fat reduction, for exactly what is very important, the volume loss of the fat under the skin, the operator needs to use depths of over 4 millimeters, all the way up to 8 millimeters. However, for skin tightening, we need to keep the needle depth to above 3 millimeters, no deeper than 3, maximum 4 for some areas where you actually see that you want to deliver energy a little deeper. So what can you expect post-Morpheus body treatment? Well, you can expect some redness, some mild swelling, some areas that look very taut or shiny for almost 1 week after the treatment. There's flaky skin and light peeling, very common. And with deeper treatments for cellulite or body fat reduction, which again, the needles can be as deep as 8 millimeters. The energy gets delivered a little deeper than 8 millimeters when you activate the 3D Morpheus energy setting. So you can technically penetrate and melt fat up to 1 centimeter depth. So if your fat is like 10 centimeters, imagine how many sessions you need with Morpheus to get all of that melted away, right? So when the needles penetrate, because I started saying that the needles are penetrating and what to expect afterwards, and then I went to explain that the needles can penetrate all the way up to almost a centimeter, you might see some bruising, especially in patients who bruise easily. Most people start to see meaningful improvement at about 4 weeks. The complete results are at the 3 months mark. Morpheus works best in a series of 3 treatments spaced about 8 weeks apart because you want some time to heal from your previous session, especially since it involves needles. Now, as cellular turnover occurs over time, spacing the treatments apart might help renew and repair multiple layers of your skin while melting fat. So I do recommend 8 weeks between the treatments. What are the disadvantages to Morpheus? Well, the main downside is you shouldn't get the treatment if you're sunburned or you plan to go tanning anytime soon, like within a week or two. What about risks and side effects? Well, I started with the least likely to cause a problem, and we're moving towards Morpheus, the most likely to cause a problem. The risk with Morpheus body for hyperpigmentation, for scarring, for burns, it's much less likely compared to all the complications with liposuction, but all the technologies I mentioned before Morpheus body do not have any of those complications. It is true that Morpheus body, by delivering the dual action of microneedling and heating the tissues underneath the skin and delivering the energy in the fat with radiofrequency, can significantly melt the fat down to 1 centimeter below the skin and improve laxity and the sagginess of the skin in the treatment area. You don't need to use applicators to cool the skin like WarmSculpting or TempSure. You just have a handpiece applied to the skin, and the foot pedal activates the needles, penetrate the skin, deliver the energy, one push of the pedal. There is downtime with Morpheus body. When you walk away, you feel a little red, you see the puncture marks, which is different than any other applicator I told you about before, because your skin's going to be red for maybe a few minutes to half an hour and it's gone. Then you don't even know you had a treatment. With Morpheus, you know you had a treatment. So if your skin gets penetrated by the needles, obviously it is crucial that this procedure is done after cleaning the skin very thoroughly with alcohol. And it is crucial for you, the patient, that absolute hygiene is maintained for at least a week until the skin heals from all the microneedle puncture wounds. Now, a major disadvantage to this treatment, and I'll be very honest with you because I've done the treatment and I've seen it done, is the pain. There is significant heat delivered into the fat. You feel it and it hurts. Yes, you can use Pronox, which we have. That's inhaled nitrous oxide. However, on top of that, we do a little tumescent anesthesia in the areas that we want to treat, especially the arms and the thighs or the flanks, the bra roll. It will increase the comfort level significantly. There are many people who find the repetitive action of the microneedling very uncomfortable. It's not that rare. It happens. Not often, but it happens. After one treatment, quite a few clients come back and say, you know what, it's too uncomfortable for me. I need to switch to something different. And luckily, I'm the kind of practice that says, yep, let's do sculpture, let's do tight sculpting, let's do some RF. And we give them the option and explain, and we can continue getting closer to their client's dream of the body that they see in their mind, but they also want to see in the mirror. So that's the beauty of having a practice with multiple devices, right? You can switch to something else. My number 6 platform, last but not least, I really want to say a few words about MSculpt Neo. This is made by BTL Aesthetics. It is a unique and very special, therefore very dear to me personally. Obviously, I used all these technologies I'm talking about outside of Vanquish and outside of liposuction. So I can speak to each one of them, not just as a doctor and provider and as a person that administers these procedures, but as a person who has experienced them on her own body. MSculpt Neo is unique. There's nothing like it on the market that is using high fem technology at this point, which is high intensity focused electromagnetic energy, is delivered to many possible areas of the body. The arms, the legs, the trunk. It does 3 things all at once. It can help destroy the fat. It will grow and strengthen the muscle underneath and will tighten the skin. Isn't that amazing? So this is a true, not just a body contouring device. Nothing that I talked about previously, all these other platforms do really do anything regenerative in the body. They just destroy the fat. They tighten the skin. None of them grow muscle. Why do I love growing muscle so much? Well, if you watch me on social media, you know I've done multiple posts about one key thing for anti-aging, the secret. And that is our functionality. Once we turn 70, everything depends on how much muscle we have. How strong we are, it's going to determine how long we live. And that's all dependent on how much muscle do we have. So this device, the MSculpt Neo device, has 2 large applicators and 2 smaller applicators. And they've come up with another applicator that's used for the love handles. So it can be applied to the abdomen, to the love handles, to the arms, the buttock area, to the thighs, etc. What does it do? Well, it will stimulate and cause a supramaximal muscle contraction. So if you wonder, what the heck is a supramaximal muscle contraction? Well, it's a contraction much stronger than you would be able to generate on your own. That's why you can't do this by going to the gym. What is also mind-blowing is the fact that in a 30-minute session for an abdominal treatment, the device generates the equivalent of 20,000 pulses, which equals to 20,000 contractions. I don't know about you, but I don't think I'm going to do 20,000 sit-ups in my lifetime, okay? There are different intensity contractions because the machine has a patented protocol that delivers different type of pulses. Kind of like you have a different contraction when you do a sit-up versus a plank, but they both engage your core muscles. So, like I said, I don't know how many yoga sculpt classes it will take for me to generate 20,000 contractions in my abdominal muscles, which is why working out will never give you the same results as far as strengthening the area that's treated like this machine does. Its applicability goes beyond body contouring. I have personally used this device to rehab my quad muscles after my last knee surgery in 2023. All it took was about 4, maximum 5 sessions, I think, to bring my quad to be equal to the quad on the opposite side. And I did them about 1 to 2 weeks apart. My last knee surgery before that was in 2015, a similar meniscus tear. It was a bucket handle tear for both times. That one required 10 weeks in a knee brace with minimal weight bearing. It took me a year and a half to bring my quad to be equal to the one on the opposite side. In 2023, thanks to MSculpt Neo, it took me 2 months. So I can reliably say about MSculpt Neo, it's the least uncomfortable of all the technologies for body contouring I discussed in this podcast. It's also highly customizable as far as the intensity of the contractions that are generated. And you usually start between 40% and usually you can go all the way up to 100% intensity, maybe not on the first session, but definitely after the second or the third. It literally feels like a very strong, ticklish feeling. It's a little anxiety provoking at the beginning when you feel your muscles engaging without your body moving at all. You're just simply lying on the table. How many of you listening to this podcast have injured themselves exercising or playing sports? How many of you relate to not being able to walk because you had knee or foot or hip surgery and you know how limiting that is and how restricted you had become without your ability to walk on both legs without crutches or a brace? How many of you relate to the feeling of weakness in your body and the need to adapt and limit your movements and intensity of exercise to your muscle weakness, to your pain, to your joint instability? And all of this comes down to one thing and one thing only. How strong is your muscle? It is what keeps us going, what keeps us fulfilling a purpose, what keeps us alive and healthy. We lose our muscle, we lose strength, we lose movement, we lose energy, we lose stamina and endurance, and we will not recover well from whatever we're going to go through. Okay? I'm going to end this podcast episode by reminding you of sarcopenia. I don't want any of you ever listening to this to go into the future 10 to 20 years from now and say, shit, I should have listened to Dr. C. What is sarcopenia? It's muscle atrophy and generalized muscle loss, primarily caused by the natural aging process, but mainly combined with inactivity and a poor diet. It's devastating. I could talk a lot about protein intake here. We do need fuel to build, to regenerate, and keep our muscle. Many of us are driven by carb cravings and fatty foods that taste rich and delicious. We're not driven by protein, unless it's a very juicy, nice steak, right? I will end with a warning. There is no cure for sarcopenia. none that conventional medicine offers other than diet, supplements, exercise, and physical therapy. The technology I speak about, MSculpt Neo, can be amazing at keeping and maybe regenerating muscle. I see a big future in anti-aging for such technology, especially as the truth of aging sinks in. It is all about our muscle and about weakness as we lose our muscle. The more fat we have, also the less muscle we have. The more achy we become, the more warning that is that you have muscle weakening around your stiff joints. The less we move, the weaker we become and the more muscle we lose. And last but not least, we can easily be forewarned by checking our body mass composition and acting on it. Well, I got a little distracted by muscle mass. I could keep going. I will soon get another episode to talk about this. But for now, let me end this with a warning for everyone that is currently using a weight loss medication like Ozempic or Wegovy or Zepbound or any kind of appetite suppressant medication. Please check your body mass composition with a reliable device, not a scale you just step on. It's got to be something that measures your height, your weight, and your body mass composition, probably through electrical impedance. We have the InBody into the practice, and we offer that for free with our VIP membership. Other than that, it's like $25 to $50 at the gym or in our office. There's plenty of places that offer it. You want to track it monthly if you're on these medications. If you start losing muscle mass, you need to stop, and you need to understand what is happening and how you can reverse it. Otherwise, muscle loss is very hard to deal with and very expensive to get back. Obviously, we want to age well and gracefully, and we want to lose weight in a healthy manner. And these drugs are amazing, right? They can give us that, the weight loss. Focusing on functionality as we age or as we lose weight is also crucial. And last but not least, body contouring does not have to be all about burning and shaping the fat. It can also be about building strength and toning, which will definitely not just make us look better. It will make us feel better and more confident, which is ultimately what this is all about. My last words on this topic for today's episode are that looking into the possible future between all technology for body contouring as it continues to develop and the new weight loss peptide therapies, we literally, all of us should be able to look better, feel better, and stronger without the need of invasive and risky surgical procedures, liposuction, so on and so forth. If you listen to this podcast, you wish to know more about how to incorporate these body contouring procedures towards achieving your dream about a certain look, simply book a consultation. Myself and my team would be honored to help you achieve your health and beauty goals. We're here for you. Thank you for trusting me with your time, and thank you for listening to today's episode. If the content I provided wowed you, was helpful and valuable to either you or someone close to you, please do me a favor and leave me a review. I am very open and welcome any kind of feedback as well as suggestions on any content ideas, so please forward those suggestions to Jessica, my patient care coordinator, through our website, herabeautyandwellness.com. And I look forward to our time together next episode.